And we're back now with Syndicated columnist Kathleen Parker and Politico's Roger Simon. So, has the president taken the public option off the table, or hasn't he? And if he hasn't, why hasn't he?
Well, go ahead.
I thank you, Kathleen. I think he's going to let the U.S. Senate take the public option off the table for him.
Yeah.
The public option is popular in his party. It's a misconception that the left wing of the Democratic Party wants the public option. The left wing of the Democratic Party wants single payer, what they have in Canada. It's the Democratic wing of the Democratic Party that wants the public option. And that is the wing that Barack Obama slowly has to move off of it. And he's going to use the Senate and say, look, we can't get it passed. We're not going to lose this whole bill over it.
Yeah. No, I agree with that. That's exactly right. Why would he remove it? As Roger says, somebody else is going to do it for him, and then he can say, look, I did my best, and he doesn't alienate, his own party and the process, and it's off the table clearly, but it's not his fault.
But all right, so it's once it's off the table, he's still got a whole bunch of Democrats over there in the House that say we don't like anything unless it has this public option, as you say, Roger, and you do have these senators who say no way, no how. Will they come together? Can he bring them together and get them to pass the other things that he wants and that he can probably get passed? Or can he?
His argument is going to be, look, you're never going to have a president who is more popular right now, even though my numbers may be dropping. If we don't do it now, we're not going to get it done. We've been talking about this thing for decades. Your constituents want health care reform. They want insurance reform. Are you really going to be the person who goes back to your district and says, I'm denying you health care reform in your lifetime because it wasn't exactly what I wanted, or we're going to take what we can get?
Right, and this is, without the public option, this is still vast reform. This is a huge, huge step. And I think what the president will say is, look how far we've come. We really have. Backing up just a minute, if you talk to anybody in this process along the way, they've known all along sort of where we were going to wind up, that it was going to be just, the public option was really never going to be taken seriously, certainly on the Republican side. And so, a lot of the moderate Democrats have been sort of hoping that this group of six would save them so that they could vote for something that they believed in and that they could go home and defend. So this is actually, in the end, going to end up pretty much where people sort of knew it was going to end up, but they had to go through this process and play the political game along the way.
Do you think in the end that any Republicans will vote for this, with the possible exception of Senator Snowe, Kathleen? I know you have very good sources on that side of the aisle.
Well, there is this sort of assumption that there are no Republicans that could support health care reform. That's not true. That may be true on the House side, but there are plenty of people on the Senate side who, if we have something included that is a Republican idea, then they're going to come on board. So yes, I think some Republicans will vote for this.
I'm not sure. You may be right, but we're in an era of hyperpartisanship. This is clearly going to be a Democratic health care bill. The Democrats are going to take credit for it, for doing this historic act. And there's very little upside, if you're a Republican, for adding your name to it, and possibly a lot of downside. No one knows how it's going to work. Most importantly, especially the Republicans, no one really knows how we're going to pay for it.
Do you think, Roger, that the president has simply tried to bite off too much? The question that I asked David Axelrod. I mean, in addition to health care, he's launched all of these other programs. I'm not saying that any of them were not programs that perhaps needed to be done, but is this too much too quickly here?
He was elected as a change president. That was his message. After 8 years of portraying a president who didn't do much except plunge us into a foreign war, this is what Barack Obama sees as his mission. It's what his party wants. And I think it's, at this point, still what most of the country wants.
I do agree with you. I mean, change is what he ran for, obviously, but it has been a lot at once. This comprehensive health care reform plan that's so complicated. Anybody who's read it, realizes that it's almost incomprehensible in parts, the House bill certainly. And so, and Americans they're uneasy. There's so much else going on. They've lost their jobs, and they see this huge growth of government cost, and then now we've got Afghanistan escalating, so that adds another wrinkle. So, if he had taken pieces of reform and done it incrementally, I think there would be less unease, but yet, it wouldn't have been what he promised.
There's no question he is the best salesman on the staff. But does he run the risk of overexposing himself? I mean, he has done so many speeches now, and yet there's another one, and then another one. Does he lose some of his power by talking too much?
Well, I do wonder, they're going to have to change it to Obama span, because he's on TV giving a speech all the time, and we never get off the note-taking ticket. But yeah, there is always that risk of overexposure, and yet, if you watched his speech yesterday in Minneapolis, he sort of redeems himself every time he goes out there in front of the public, because he is so good.
It is a risk, but he keeps topping himself.
Yeah.
Every time you think, this guy can't give another speech that's better than the last one, he gives another speech that's better than the last one, and he's achieving his purpose. It wasn't really a bipartisan speech to Congress, and it wasn't really to unite Democrats around a plan. It was to unite Democrats around him as a man who can get this job done.
All right. I want to thank both of you.